I'm looking forward to partnering with TruKera. As far as the corneal health, they're getting involved in really rebranding and working with multiple companies beyond just osmolarity testing. I'm excited to start using the new ScoutPro. I think it's really going to improve our efficiency and workflow in the office, especially around cataract and refractive surgery. Right now, when we think a patient has dry eye, it may affect how we do our measurements, preoperative biometry and topography measurements. Now using the ScoutPro, I think it's really going to redirect which patients can move on and get our testing right away and which we have to treat for dry eye and have them come back before we get more accurate testing. I'm excited to start using the new ScoutPro device. I think it's really going to change the workflow in the office, especially around cataract and refractive surgery patients. In the past, we've had a workflow whereas the patient that had dry eye would have to get additional testing. They'd have to treat for dry eye before they could actually have their biometry, and that's fine. However, if we use the ScoutPro, we'll know right away the patients that have dry eye, not even perform the tests at that time, and have them come back. It's a much better workflow. My past experiences with the older device was a little cumbersome. It took more time to do the testing, and right now using the device, it's approximately 10 seconds per eye. I realize now the importance of osmolarity testing, especially around the time of cataract surgery. In Alice Epitropoulos' study, she showed that 20% of the patients actually had high hyperosmolarity testing, which actually led to over a diopter change of topography Ks in those patients. So 1 out of 5 patients having over a diopter change if they had hyperosmolarity. So I feel the importance of testing is there now using the ScoutPro. We do a lot of testing around cataract surgery. We do surveys for symptoms, and now we're beginning to use the ScoutPro. This has really changed the workflow because it's so much more practical to use this device. The patients get this testing on every cataract patient before the surgery, before the testing, and it really adjusts the workflow of what the next tests are or if we have to start treating for dry eye or MGD. We want our best outcomes for our patients. We want to use the best technologies and have the best techniques, but a lot of this goes before the surgery. Getting the proper testing, getting the proper results, and one of the ways of doing that is treating the ocular surface or seeing if that ocular surface needs to be treated before the measurements are even being made. We are beginning to start using the ScoutPro to help us determine these things. By seeing if the patients have an hyperosmolar state, we can treat them for dry eye in addition to getting the testing, and then repeat the testing if necessary to see if there's any change. I believe this will improve our outcomes for our patients. I had the opportunity to use the original device years ago, and the device itself worked well. However, the workflow was the main problem. So a lot of times you don't understand the difference in how important it is to have it work well within the office, have it be efficient, have a good implementation program for the staff. Those are the important things beyond just having the efficacy of the device or how well it actually works. So the difference between the old device and how practical and much quicker the new device is really important. I think that's one of the more important, if not most important, selling points to this device. It's remarkable how quickly the device works, maybe around 10 seconds per eye. So by 40 seconds, we're pretty much done with this test. In the past, we had to take this to the station. It was much worse of a workflow. We had to come back, do it again. It works well now. It fits in the pocket. One tech can carry it around if necessary. They can hand it off to another. The efficiency of using this device compared to how it worked before is remarkable.